Hello, my name is Darlene Clark Gonzalez. Breast cancer is the most commonly occurring cancer in women. While it's certainly a life-threatening cancer, nearly all women could survive if they found it early. The University of California, San Diego Cancer Center, and Deaf Community Services of San Diego, together with the UCSD Department of Communication and Gallaudet University, have created this breast cancer education program for deaf and severely hard of hearing women. It's important for both communities to have a better understanding of breast cancer, how it can be detected in the earliest possible stages, and why early detection can make a life and death difference. As a deaf woman, I had a very limited understanding of breast cancer before I began to work with this program. This is important information for you to know. As my friend Kathy Buckley will tell you, women who are severely hard of hearing also need to be offered a better understanding of this disease and what to do about it. Kathy will speak to hard of hearing women while I sign for the deaf women.
Thank you, Darlene. Hello. Breast cancer is one of the most frightening diseases a woman can face. I know. I'm a cancer survivor. I did not have breast cancer. I had cervical cancer. Early cancer detection can save lives. It saved mine, and it can save yours. When I was diagnosed, I was totally clueless, full of questions. The fear was overwhelming. It was like the disease all by itself. I want other women to have the same excellent chance of survival that I have. For that, you're going to need information. Darlene Clark Gonzalez has invited us to join her at a breast cancer training session. It has been specifically created for deaf and hard of hearing women like myself. I know from my own experience that the more information you have about breast cancer, the better chances of your survival. Better yet, the earlier that a woman finds breast cancer, the more treatment choices she will have. Darlene's breast cancer education program is just about to begin. So let's join her.
Today I'm here to explain about breast cancer and how early detection can save your life. Now let's begin. If the doctor tells you that you have breast cancer, it does not mean that you'll surely die. With early detection, most women will survive breast cancer. What exactly is breast cancer? The body makes new cells to replace the old cells. Look at this smiley face representing a normal cell. When it reproduces, it usually produces other cells just like itself. Once in a while, it produces a cell that is slightly different, like this smiley face cell with one sad eye. It may take many more small changes like this before one change occurs which forever changes how that new cell will behave. Suddenly, this cell becomes aggressive in the speed with which it makes new cells just like itself. This cell is now behaving like a cancer cell, and the growing accumulation of cancer cells is called a tumor or a lump.
Charlene, how do I know if I'm at risk for breast cancer?
How do I know if I'm at risk for breast cancer? The three greatest risk factors are being a woman, growing older, and having a mother, sister, or daughter with breast cancer. A small number of men also get breast cancer each year. Why is early detection so important? With early detection, breast cancer can be found when it's still as small as a bead on a dress. Late stage means identifying the cancer after some cells have broken off from the original tumor cluster and moved through the blood and lymph systems to other parts of the body. It could be the liver, bone marrow, brain, kidney, or any other organs. These beads are like tumor sizes. The smaller the bead, the less chance that cells have broken away from the tumor and moved to other parts of the body. If they do detect breast cancer and it was detected early, how much does life expectancy increase? Imagine 100 women who have breast cancer from each group, early detection and late detection. Let's compare how many women will survive through the years. For early detection, after 5 years, 98 women will still be alive. For late detection, after 5 years, only 10 women will still be alive. For early detection, after 10 years, 95 women will still be alive. For late detection, after 10 years, 2 women will still be alive. For early detection, after 20 years, 92 women will still be alive. For late detection, after 20 years, it's unlikely that any women will still be alive. Clearly, early detection made a huge difference in the number of survivors. How can we find breast cancer early? There are currently 3 ways to find breast cancer early: mammography, clinical breast exams, and breast self-exams. Let me tell you what you need to know about each of these 3 methods of early detection. The first method is mammography. Mammography is an X-ray of the breast. On a first mammogram, a breast cancer can be found that is smaller than the size of a pea. When a patient has had prior mammograms, her doctor can compare the earlier ones with the current mammogram. Doing this allows them to find even smaller differences. Women should have a mammogram every 1 to 2 years beginning at age 40 and every year beginning at age 50. A mammogram can also be done at any age when the doctor or woman feels an abnormality in the breast tissue. Most breast cancer occurs in the upper outer portion of the breast. It's important to have a mammogram because it can find the smallest breast cancer, smaller than a pea. It's very important for the mammography technician to gently but firmly pull all of that breast tissue onto the mammography plate so it will be in the picture. This tugging, pulling, and compression will last about 15 seconds. The mammogram provides the best picture. Also, do not use deodorant or powder before your mammogram. This can cause false images on the X-ray. Mammography can find 85% of breast cancers. Because 15% of breast cancers are missed by mammography, it's important for women to also use the other two methods, clinical breast exam and breast self-exam. In a clinical breast exam, your doctor or nurse practitioner will do the breast exam for you. Beginning at age 20, this should be done every 3 years. Beginning at age 40, this should be done every year for the rest of your life. Breast self-exam should begin at the age of 20. How do you do a good breast self-exam? You can call your local American Cancer Society or the National Cancer Institute's 1-800-4-CANCER for a good brochure. I want to explain and show you how to do a good breast self-exam. There are several key points to doing a good breast self-exam. The first step is to look at your breasts in the mirror. Put your hands on your hips. Are your breasts the same size and shape they've always been? Is there any dimpling and/or lumps in any part of your breasts? Raise your arms and look at your breasts in the mirror. Then when you look in the mirror, bend over and see if there are any changes in the breasts. The next step is to lie down on your bed and place a towel or a small pillow under the shoulder of the breast you will examine first. I just showed you how to lie down with a pillow or towel underneath you. Now I'll explain how to slide your fingers along the breast. Do not lift them, slide them so you won't miss a change. Now repeat the process. Use a vertical strip pattern so you cover the whole breast, including the breast tissue that continues into the armpit. It's best to do a breast self-exam after your menstrual period because the breasts are less tender at that time. If you are no longer menstruating, you can examine your breasts any time of the month. Please teach your friends and loved ones how to do a breast self-exam. You could help save their lives. What happens if I find a lump? 80% of lumps are not cancer, but further diagnostic tests will be needed. Additional mammograms may be suggested. Ultrasound is another diagnostic option. It's a completely painless procedure. Sometimes the doctor will recommend a follow-up in a few months if these tests are not conclusive. A biopsy may also be recommended. If a biopsy is needed, this will be done as an outpatient. The biopsy area will be anesthetized, just like you get when you go to the dentist and have a local anesthetic for your cavity filling. The same process occurs. The doctor will use a local anesthetic so the procedure is as painless as possible. One biopsy method is called fine needle aspiration. In this case, a needle is used to withdraw some of the abnormal tissues out of the cluster of cells so they can be examined under a microscope. If abnormal cells are found, treatment will be needed. Why do they need to do a biopsy if it's breast cancer that I'm worried about? If you have breast cancer, you and your doctor must decide what treatment will give you the best chance of survival. Knowing whether there is a high or low risk that the cancer has spread beyond the breast, the first place cancer cells might get trapped is in the lymph nodes under the armpits, so the doctor will check there.
You said that we have more treatment options if breast cancer is detected early. Would you please explain?
You said we have more treatment options when breast cancer is detected early. Will you please explain? There are two surgical treatment options. If the cancer tumor is very small, a lumpectomy may be an option. In a lumpectomy, only the abnormal cells and a very small amount of normal cells surrounding the tumor are removed. For larger cancers, the surgeon may feel that a mastectomy is needed. In this case, the entire breast is removed. Sometimes all of the lymph nodes from the armpit are removed as well to reduce the risk that cancer cells in the lymph nodes will grow and spread to other parts of the body. In the event that a mastectomy will be needed, women should also have a pre-surgical consultation with a plastic surgeon so that they have the option of breast reconstruction later. In addition to surgery, there are other treatment options that may be recommended if the spread of the breast cancer is a possibility. These include radiation therapy, chemotherapy, and hormone therapy. Radiation is used to kill any abnormal cells in the breast that are not yet visible on a mammogram. Chemotherapy is used to kill any cancer cells that may have spread to other parts of the body. Hormone therapy may also help. Sometimes a woman's ovaries are also removed since they produce the natural hormones that help the cancer grow. We have already discussed 3 standard treatments. In addition, another important option to consider is clinical trials. These research studies help find promising new drugs for people with breast cancer. People often avoid clinical trials because they don't really understand what they are. The best option would be to remain open to hearing about a clinical trial. Tell your doctor that you would like to be informed if there are any clinical trials for which you might be eligible. Then you can decide whether this is something in which you would like to participate. How do I know if a trial is a real study or just someone's crazy idea? The National Cancer Institute is your best source for more information. You can call them for information about specific clinical trials and specific healthcare facilities and doctors who are offering carefully controlled studies. There are also internet sites that can be searched for additional information. The National Institutes of Health offer an extensive list of trials available throughout the country for all kinds of health problems, including cancer. You've been excellent and attentive learners. Let's now go out and spread the word about the importance of early breast cancer detection to other deaf and hard of hearing women. You can save their lives.
That was an excellent overview. It's good to review these points periodically to keep them fresh in our minds. It's equally important to keep up to date on the latest development in the field of breast cancer research. It seems like every few days there's new research study reported that explores ways to advance our understanding of the prevention, detection, or treatment of breast cancer. Also, as Darlene advised, stay open to the option of clinical trials. Most importantly, be sure you and your loved ones follow the early detection guidelines. Do monthly breast exams and have clinical breast exams every 3 years beginning at age 20. At age 40, begin having your clinical breast exam every year and consider beginning mammography screening every 1 to 2 years. By age 50, have mammograms every year plus your yearly clinical breast exam and your monthly self-breast exam. Just think about the impact we could have on the lives of deaf and hard-of-hearing women and their loved ones if we could all get breast cancer detected by the earliest possible stage when the chances of cure are the greatest. Thank you, Darlene, for all the information and for helping making a difference in our lives. Thank you.